So I'm going to talk to you about beta blockers. Beta blockers are currently the best drug we have for heart patients, and it's kind of like a magical drug, and I'll explain to you why. Beta blockers, the generic name ends in LOL, okay, or little old ladies, or whatever funny thing that you've learned about, but they all end in LOL, like metoprolol, propranolol, and that's how you can identify that it is indeed a beta blocker. Every cardiac patient that you have, whether it's a history or it's an acute problem, should be on a beta blocker. If they are not on a beta blocker, then there needs to be some good documentation by the physician of why they're not on a beta blocker. Could be something like they're allergic to it, or if they have an asthma problem, lung problem, then you need to be cautious because we have beta cells in our lungs as well. So sometimes you put somebody on a beta blocker and they can't breathe. So those are the two kind of main reasons why we wouldn't put somebody on a beta blocker. Otherwise, it's a very important drug. If you have a patient on a beta blocker and they have surgery or their vital signs make you question whether you should give it, then you need to consult the cardiologist because they might be okay with a systolic blood pressure of 85 or a heart rate of 50, whereas that seems very low to us on a med-surg unit, but you need to make sure with the physician what the parameters are, what they want you to do, because again, it is a very, very important drug for a cardiac patient. And as a really good nurse, you need to know that. You need to understand the beta blocker is one of the most important drugs that a cardiac patient can be on. Okay? So a beta blocker really does three things for the heart. It slows down the heart rate, it vasodilates, and it helps with filling and stretch of the heart. Okay, so the heart rate is going to slow. So what happens when we slow? So we have our heart like this, right? We put them on a beta blocker, now it's slower. And there's more time for filling. Okay, and what happens during filling? We feed the coronary arteries oxygen, and we get more preload and more stretch. And so now we have a stronger contraction. So we're improving the force of contractility. Okay, so we're improving contractility with the beta blocker. We're giving the heart oxygen. We're feeding the heart oxygen. Okay, that makes the heart happier. The other thing that it's doing is it's vasodilating. So it's reducing our afterload. And by doing that, it improves the ability for the heart to pump the blood out to the body. So it reduces this pressure. It makes it much easier to get the blood out. Okay, so very simple. So next time you guys are in clinic, or you're talking to your cardiologist, and they say, well, what does the beta blocker do? Or the family, okay, whoever it is that you're going to teach. You say, well, it does a few things. It slows down the heart rate. You get better filling, better stretch, stronger contraction, better perfusion to the heart, and it lowers the pressure that the heart has to pump against, so it makes it easier for the heart to pump. So in total, what it does is it decreases the workload of the heart. That's its overall goal, and that is our overall goal for all of our cardiac patients.